Think of it like a puzzle.
Mhm.
We're trying to see, which pieces might fit together.
I like that.
Yeah.
So before we get into the specifics of the study,
Okay.
let's take a step back.
Sure.
Why are we even interested in these factors, like neighborhood dynamics or someone's health history?
Right.
What makes them relevant to aging in place?
Well, it's all about understanding the ecosystem
Mm-hmm.
that supports someone's ability to age in place successfully.
Okay.
So if you imagine, an older adult who wants to stay in their home,
Mm-hmm.
there are so many layers to consider.
Right.
Their individual health,
Yeah.
their support network,
Mm-hmm.
even how their community is designed.
Okay.
All of these things can either help or hinder their ability to maintain their independence and well-being.
That makes a lot of sense.
Yeah.
So it's not just about like willpower or, just wanting to stay in your house.
Right.
It's about having the right pieces in place to make aging in place a realistic and positive experience.
Precisely. And that's what makes Billings' research so interesting. She specifically looked at whether things like neighborhood trust and safety,
Mm-hmm.
cardiovascular illness,
Yeah.
and mental health affect someone's likelihood of aging in place.
And those seem like pretty intuitive factors, right?
You would think so.
Like we would assume a safe neighborhood or good health would make it easier to stay at home as you get older.
You would think.
Yeah.
But that's where things get really interesting.
Okay.
Billings' study actually found no statistically significant relationship between any of those factors and aging in place.
Wait, really?
Yeah.
That's kind of surprising. I mean, I can see how maybe those things aren't the be-all and end-all,
Right.
but to find no connection at all is...
I know, it is a bit of a head-scratcher.
Yeah.
And it's important to note that other studies have found links
Okay.
between these factors and aging in place. So this
Nice.
isn't necessarily like the definitive answer.
Right.
It does highlight, though, the importance of considering the specific context of the study, including how the questions were asked and the particular population being surveyed.
So maybe it's not that those factors don't matter, but that the way they were measured in this study didn't capture their full impact on aging in place.
That's one possibility.
Okay.
Or it could be that other factors, like family support or access to services,
Yeah.
played a stronger role in this particular data set and kind of overshadowed the impact of neighborhood and health.
That's really interesting to consider.
Yeah.
So it sounds like we need to dig a bit deeper into what the study actually measured and how those findings might differ from other research in this area.
Absolutely. And that's exactly what we'll be doing as we unpack this study further.
Sounds good. Now, you mentioned that Billings did find some factors that were significantly linked to aging in place.
Yes.
Want to walk us through those?
Definitely the study found that sex, age, marital status, and education level all played a significant role in predicting whether someone could successfully age in place.
Okay, let's start with sex. The study found that females were more likely to age in place than males.
Right.
What are some possible explanations for this?
Well, there are a few things that could be contributing to this finding.
Okay.
On average, women tend to live longer than men,
Mm-hmm.
so they may simply have more years to age in place.
Right.
They also tend to have stronger social support networks,
Okay.
which we know can be crucial for navigating the challenges of aging.
Yeah.
It's also possible that cultural expectations around caregiving play a role,
Mm-hmm.
with women traditionally taking on more caregiving responsibilities,
Okay.
which might make them more comfortable with seeking and receiving support as they get older.
That's an important point. It's not just about individual characteristics, but also societal norms and expectations that can impact someone's ability to age in place.
Right.
What about age itself? I imagine the older you are, the harder it gets to stay in your own home, right?
That's a common assumption. But in
Mhm.
this study, it wasn't quite so straightforward. Billings found that people aged 65 to 84 were actually more likely to age in place
Sure.
than those aged 85 to 95.
I wouldn't have expected that. Why do you think that is?
It's a fascinating finding, isn't it?
Yeah.
It suggests that there might be a sweet spot
Okay.
where individuals are still relatively healthy and independent, but also have had time to build up a strong support network and adapt their living spaces to their needs.
Mm-hmm.
Then as people move into their late 80s and 90s, they might be more likely to experience health challenges or require a level of care that's difficult to manage at home.
Okay.
It's important to remember, though, that this is just a snapshot in time.
Right.
We don't know the full stories of these individuals or what specific factors might have influenced their transitions later in life.
That makes sense. It's a reminder that aging is a dynamic process, and our needs and circumstances can change over time.
Exactly. It's not a linear progression where everyone inevitably ends up needing institutional care.
Hmm.
There are many different paths to aging well.
So let's move on to the next factor, marital status.
Okay. The study found that married individuals were more likely to age in place than those who were separated or never married. Is that surprising?
Not necessarily.
Right.
Having a partner can provide a built-in support system, both practically and emotionally.
Hmm.
Someone to help with chores, transportation, doctor's appointments,
Yeah.
and just to offer companionship,
Right.
not to mention the financial benefits of sharing expenses.
That makes sense. It's not just about romance. It's about having a teammate as you navigate the challenges of aging.
Exactly. And that's not to say that single people can't age in place successfully, of course.
Right.
It just highlights the importance of cultivating a strong support network, whether it's through family, friends, neighbors, or community organizations.
Absolutely. Now, the last factor the study found was education level.
Okay.
It seems that those with at least some college education were more likely to age in place compared to those with less than a high school education. Any thoughts on why that might be?
There are a few potential connections there.
Higher education often correlates with higher income, which can mean greater access to resources and support services that facilitate aging in place.
Mm-hmm.
It might also be related to health literacy, with more educated individuals potentially being more proactive about their health and more comfortable advocating for their needs within the healthcare system.
So it's not just about the knowledge you gain in college, but also the skills and resources that often come along with it.
Exactly. It's about having the tools to navigate the complexities of aging and to access the support you need.
So we've got these four factors that seem to be pretty influential in aging in place, but I'm curious, how do they all fit together?
Yeah,
It can't just be a checklist, right? There must be a bigger picture here.
you're absolutely right.
Yeah.
It's not just about checking boxes. It's about understanding how these individual factors interact with each other and with the broader environment.
Okay.
And that's where the socio-ecological model, or SEM, comes in.
The SEM, we touched on that briefly earlier. Can you remind us what it is and how it applies to aging in place?
Absolutely. The SEM is basically a framework that helps us see how different layers of influence, individual, interpersonal, organizational, community, and policy
Mm-hmm.
all interact to affect someone's well-being.
Okay.
Think of it like concentric circles,
Okay.
with the individual the center and each layer rippling outward.
I'm starting to see the picture here. So while this study didn't find strong connections between certain factors and aging in place, the SEM reminds us that it's a much more nuanced and interconnected process than just looking at a few isolated variables.
Exactly. And we'll dive deeper into how the SEM can help us understand aging in place in the next part of our deep dive.
That's good.
Welcome back to our deep dive into aging in place.
Yeah.
The first part, we talked about some intriguing findings from Brenda Billings' research,
Yeah.
like how neighborhood factors and health conditions didn't have as strong a link to aging in place as you might expect.
Right.
So that leads to the question, if not those things, then what does make a difference?
Yeah, exactly. If those aren't the main drivers, then what? And even more importantly, how can we actually use this knowledge to create communities that truly support people as they age?
That's where the socio-ecological model, or
Yeah.
C,
Mm.
becomes really powerful.
Uh-huh.
It's not just a theoretical model. It's like a practical roadmap for action.
Okay.
It helps us understand that aging in place isn't just about individual choices.
Mm-hmm.
It's about creating an environment
Yeah.
where aging in place is a real possibility for everyone.
So instead of just reacting to problems as they come up,
Right.
we should be proactively building communities that support aging in place right from the start.
Precisely. Think of it like gardening.
Okay.
If you want a plant to thrive,
Mm-hmm.
you don't wait until it's wilting to water it.
Yeah.
You create the right conditions from the beginning. Good soil, sunlight, regular care.
Yeah.
Aging in place is similar.
Okay.
We need to cultivate communities that are fertile ground for people to age well.
I love that analogy,
Yeah.
but the theme seems pretty complex
It is.
with so many moving parts.
It is complex.
Yeah. How do we actually apply it to make this happen in the real world?
It is complex, but that just reflects how complex aging in place truly is.
Right.
There's no one-size-fits-all solution.
Mm-hmm.
It's about understanding how different factors at different levels all interact.
Okay.
So let's break it down,
Okay.
starting with the individual level, the person at the heart of it all.
Okay. So at the individual level, what are we looking at?
This is where we really zoom in on the person's unique needs, abilities, and resources.
Okay.
What's their health like? Do they have physical limitations, cognitive challenges? What about their social connections? Do they have family or friends nearby?
Right.
And crucially, what are their finances like?
Yeah.
Can they afford to stay in their home, access the services they might need?
So it's like creating a personalized profile for each person
Exactly.
to understand their strengths and potential challenges when it comes to aging in place.
Exactly. Once we understand those individual factors, we can move outward to the next layer, the interpersonal level. This is all about relationships and social support.
So this is where family, friends, neighbors, and caregivers come into play.
Precisely, do they have a strong support network? Who can they rely on for help with daily tasks, transportation, emotional support, or even just someone to share a laugh with?
Yeah.
Feeling connected and supported is essential at any age,
Right.
but especially as we age.
It's about combating loneliness and isolation,
Absolutely.
which we know can be really detrimental to both physical and mental health.
Now, let's zoom out even further to the organizational level.
Okay.
This is where we look at the institutions and services that can support aging in place. Healthcare providers, senior centers, transportation services, home care agencies, community organizations, that whole network.
So it's about making sure those resources are available, accessible, and affordable for older adults.
And not just available, but also age-friendly and culturally sensitive.
Okay.
For example, our healthcare providers train in geriatrics, the specific needs of older patients.
Right.
Do senior centers offer programs that are relevant and engaging to a diverse population?
Yeah.
Is transportation accessible if someone has mobility impairments?
It's about tailoring those services to fit the needs of older adults,
Exactly.
instead of expecting them to fit into a system that wasn't designed with them in mind.
Now, let's zoom out one more level to the community level itself.
Okay.
This encompasses the physical environment, social norms, and overall age friendliness of a community.
So we're looking at things like housing, transportation, walkability, safety, and
Right.
those opportunities for social connection we talked about earlier.
Is there a good mix of housing options that meets the needs of older adults?
Mm-hmm.
Single-family homes, apartments, assisted living, that kind of variety?
Right.
Is public transportation easy to use, reliable, and accessible?
Yeah.
Are the streets and sidewalks safe and walkable for people with different mobility levels?
Okay.
Are there parks, community centers, and other places where people can gather and interact?
It's about creating a community where older adults feel safe, comfortable, and connected, not isolated or limited by their environment.
Exactly. And finally, we reach the outermost layer of the ISM,
Okay.
the policy level. This encompasses the laws, regulations, and funding mechanisms that can impact aging in place in a big way.
So we're talking about things like Medicare and Medicaid housing policies, transportation funding,
Yes.
programs that support family caregivers.
Do policies incentivize home and community-based care over institutional care? Are there programs that help older adults make their homes safer and more accessible? Is there enough funding for senior transportation services?
Yeah.
And crucially, are family caregivers, who often shoulder a huge burden, adequately supported and recognized for their vital role?
It's about creating a policy environment where aging in place isn't just a nice idea,
Right.
but a truly viable and desirable option.
So you see, the DIS helps us understand that aging in place isn't about tackling one problem in isolation. It's about creating a whole web of support that spans across individual, interpersonal, organizational, community, and policy levels.
Wow, it really does paint a much bigger picture.
Yeah.
It makes you realize that aging in place is a truly collaborative effort.
Absolutely. And it's an ongoing process, not a one-time fix.
Right.
As people's needs change and society evolves, we need to continually assess and adapt our approach to aging in place.
So it's not just about building age-friendly communities. It's
Yeah.
about creating a culture where aging is seen as a natural part of life, where people feel valued and supported at every stage.
That's beautifully put.
Yeah.
It's about fostering a sense of belonging, purpose, and dignity throughout the lifespan. And that brings us to some important questions. What are the biggest obstacles to making this vision a reality? What challenges do we need to address to make aging in place truly work for everyone?
It's inspiring to think about aging in place as not just this logistical puzzle, but like a chance to really rethink how we see getting older in our society. But let's be realistic for a second. There are definitely some hurdles to overcome, right? Like,
Mhm.
what are some of the biggest obstacles to making this a reality for more people?
Yeah, you're absolutely right. There are challenges. One of the most significant is the lack of affordable and accessible housing
Okay.
for older adults.
Mm-hmm.
A lot of seniors are living in homes that are too large or too expensive to maintain,
Right.
or just not suited to their changing needs.
So it's not just about having enough housing.
Right.
It's about having the right kind of housing.
Exactly. We need a greater variety of housing options designed with older adults in mind.
Okay.
Think smaller, more manageable homes,
Mm-hmm.
apartments designed for accessibility,
Right.
co-housing communities where seniors can live together and support each other.
Yeah.
And of course, affordability is key.
Right.
Many seniors are on fixed incomes, and they just can't keep up with rising housing costs.
That makes sense. It's a complex issue that ties into those bigger societal concerns
Absolutely.
about economic inequality and access to basic needs.
And it's not just about the physical space.
Mm-hmm.
It's also about the support services.
Yeah.
Another major challenge is the lack of adequate and affordable long-term care services.
Okay.
So many older adults need help with everyday tasks like bathing, dressing, cooking,
Right.
or managing medications.
Mm-hmm.
But those services can be expensive and hard to find,
Right.
especially for people in rural areas or those with limited finances.
So even if someone's really determined to stay in their home, it might not be feasible without the right support.
Exactly. We need to invest in expanding access to home and community-based care services
Okay.
and make sure those services are affordable and work for different cultures.
Right.
We also need to find ways to better support family caregivers.
Mm-hmm.
They often take on so much, but they face burnout and financial strain themselves.
Yeah, it really highlights how caregiving is so important in our society, but often undervalued and undersupported.
Absolutely. And let's not forget about transportation.
Right.
A lot of older adults lose the ability to drive, whether due to age, health conditions, or just feeling less comfortable behind the wheel.
Yeah.
But public transportation is often limited, especially in suburban and rural areas.
So if you can't drive, you're kind of stuck.
In many cases, yes. And this not only restricts access to important things like doctor's appointments or the grocery store,
Right.
but it also makes people feel isolated and lonely.
Right.
We need to invest in transportation that works for seniors.
Okay.
Things like ride sharing, door-to-door services, community shuttles, options that are easy to use and affordable.
It's about giving seniors the freedom to get out and about, stay connected, and live a full life.
Exactly. And speaking of communities, another big hurdle is creating environments that are truly age-friendly.
Okay.
This goes beyond just having ramps and grab bars.
Mm-hmm.
It's about fostering a culture of inclusivity and respect for older adults.
So it's about shifting attitudes as much as it is about changing the physical space.
Precisely. It's about tackling ageism
Yeah.
and recognizing that older adults make valuable contributions. It's about creating opportunities for them to participate fully in community life, not just be seen as needing care.
It's about making aging in place, not just surviving, but thriving.
Beautifully said. And while there are definitely challenges to overcome,
Yeah.
there's also a lot of exciting progress happening.
Okay, that's encouraging.
Yep.
What are some of the most promising solutions or approaches that are being developed right now?
There's a lot to be excited about. One area that's really promising is technology.
Okay.
We're seeing incredible advancements in telehealth,
Mm-hmm.
which lets seniors see healthcare providers from home,
Right.
and smart home devices
Yeah.
that can monitor safety, provide reminders, and even offer assistance with daily tasks.
Wow.
And of course, social media and other online platforms are helping seniors stay connected with loved ones and avoid social isolation.
So technology can be a powerful tool to help seniors live more independently and stay connected.
Absolutely. Another exciting trend is intergenerational communities, where
Mhm.
people of different ages live and interact and share resources and support.
That's cool.
This can benefit everyone. Older adults get companionship and help,
Mm-hmm.
while younger generations gain insights and wisdom from their elders.
I love that it's about breaking down those age barriers and creating more inclusive communities for everyone.
Exactly. And finally, there's a growing movement towards person-centered care.
Okay.
This approach puts the individual's needs, preferences, and goals front and center.
Mm-hmm.
It empowers seniors to make choices about their own care and supports their autonomy and dignity.
It's about shifting from a model of doing for to a model of doing with.
Perfectly put.
Huh.
So while there are challenges to address,
Yeah.
there's also a lot of hope and innovation happening and aging in place.
Yep.
It's dynamic and evolving,
Mm-hmm.
and I'm optimistic that we can create communities where everyone has the opportunity to age well and live fulfilling lives.
That's a wonderful note to end on. We've covered a lot of ground today
We have.
in this deep dive into aging in place.
Yeah.
We've explored the research, unpacked the complexities of the socio-ecological model, and discussed both the challenges and the promising solutions.
Absolutely.
We hope this deep dive has sparked some new insights and ideas for you, our listener.
Yeah.
This is just the start of the conversation.
Right.
We encourage you to continue exploring this topic, asking questions, and advocating for policies and practices that support aging well in your own communities.
Aging is a journey we all share, and creating a society that values and supports its elders benefits everyone.
Beautifully said. Thanks for joining us on the deep dive.